Good day, everyone. I'm Helenar Chan, and on behalf of my co-authors, Mr. John Michael Chan and Dr. Mary Jane Cruz Flores, I would like to present to you our study entitled The Impact of COVID-19 Pandemic on the Battle Against Toxocariasis. The COVID-19 pandemic is a global pandemic of coronavirus disease 2019 caused by severe acute respiratory syndrome, coronavirus 2. This pandemic is posing a major and unforeseen threat to the world. Countries had to swiftly adopt and respond in order to stop the virus from spreading and provide treatment to people who have been infected. The stress that the COVID-19 pandemic has on health systems might have an influence on the control, treatment, and elimination of neglected tropical diseases, including toxocariasis, as the pandemic is anticipated to disrupt health systems, particularly in low and middle-income nations where healthcare services are already struggling to meet population demand. Toxocariasis is a neglected parasitic infection caused by nematodes of the genus Toxocara, which is prevalently found in dogs, cats, and humans. There are two main Toxocara roundworm species, namely Toxocara canis in dogs and Toxocara cati in cats. Toxocariasis is one of the most prevalent parasitic zoonotic disease ranging from the subarctics to the tropics. Majority of the cases have been recorded in Australia, Eastern and Western Europe, Hawaii, Mexico, Philippines, China, South Africa, and Southeastern United States. Among these locations, Philippines, South Africa, and China are the most affected since Toxocara species is more prevalent in hot and humid places where eggs may better survive in the soil. Also, their prevalence rates were recorded as high as 40% or more, which has a considerable socioeconomic impact, particularly on impoverished communities. In terms of the risk factors, dogs and cats are the most important definitive hosts for toxocariasis because they are the ones that harbor the adult worm, wherein these parasites are capable of reproducing sexually. Due to their zoonotic potential, they also offer a significant risk for zoonotic infection by transmitting these infectious diseases to humans with infective eggs. In addition, children and teenagers are especially at risk of toxocariasis due to their behavior and close contact with dogs and cats by playing in outdoor environments such as the streets and public parks. Moreover, the lack of information and long-term consequences of poor disease awareness among those at risk, as well as increased poverty, a fragmented healthcare delivery system, and discontinued implementation of control programs due to the restrictions caused by the pandemic have all hindered the elimination of these parasitic diseases in the affected countries. Toxocariasis transmission starts when Toxocara eggs are shed into the environment by infected dogs and cats in their feces. Toxocara larvae grow within these eggs and become infectious after 2 to 4 weeks in the environment. Since Toxocara eggs have a thick protective covering, it permits them to live for months or even years in the environment under favorable conditions. In most cases, humans or other animals are infected by accidental oral ingestion of embryonated Toxocara species eggs from contaminated soil or dirt. Infection can also be acquired by ingesting Toxocara larvae found in raw food such as vegetables or undercooked meat from infected paratenic hosts. After the ingestion of Toxocara eggs, these eggs develop into a larvae in the intestines wall, and then it migrates through the circulation to many regions of the body, such as the heart, liver, lungs, brain, muscles, and even in the eyes. A new mode of transmission was recently proposed, which is the contact with embryonated eggs on a dog's hair coat and also induce human toxocariasis. The ongoing pandemic has negatively impacted the transmission of toxocariasis as it forced people to stay at home to limit the movement of individuals and prevent further transmission of COVID-19 infections. Since the government implemented lockdowns and community quarantine restrictions, which led to work-from-home setups, it increased the prolonged exposure of human populations to animal pets, making them more susceptible in acquiring these zoonotic parasitic diseases. In addition, the fast number of growth of dogs and cats, particularly uncontrolled and feral stray populations, has also raised the risk of Toxocara species infection in humans. The lack of an efficient strategy for controlling Toxocara eggs makes eliminating this parasite from the environment more difficult. Therefore, infection prevention strategies should include measures to prevent early contamination of the environment. For the clinical manifestations, Toxocara species infected individuals are usually asymptomatic, but it may also vary depending on the affected organ, the severity of the infection, and the intensity of the human inflammatory response. There are several clinical manifestations of toxocariasis in humans, but the two most commonly documented are visceral and ocular larva migrans syndrome. In visceral toxocariasis, the larvae can migrate through sections of the body such as the liver, lungs, or the central nervous system. It then produces symptoms such as fever, coughing, enlarged liver, wheezing, abdominal pain, or pneumonia. On the other hand, ocular toxocariasis occurs when the larvae migrate into the eyes, inducing damage, and produces symptoms such as bloodshot conjunctiva, loss of visual acuity, photophobia, and ocular pain. The visual identification of larvae in tissues and organs is the gold standard for toxocariasis diagnosis in humans, while serological methods such as an enzyme-linked immunosorbent assay detecting immunoglobulin G antibodies against Toxocara excretory-secretory antigen is the reference test for immunodiagnosis. Despite the growing efforts to develop a number of diagnostic procedures for human toxocariasis detection, accurate and reliable diagnostic tests remains to be a challenge. Toxocariasis diagnosis might be addressed by using molecular approaches with improved specificity characteristics. In comparison with the conventional diagnostics, molecular techniques provide a high analytical specificity and faster turnaround times. T. canis, T. cati, and other ascaris recovered from feces or soil have been accurately identified and phylogenetically analyzed utilizing polymerase chain reaction or PCR. Also, the introduction of loop-mediated isothermal amplification or LAMP of nucleic acid has enabled a rapid and low-cost method for determining the presence of Toxocara eggs in the soil. The COVID-19 pandemic has also a major impact on parasitological diagnosis of toxocariasis. Many laboratories had to postpone or limit their regular parasitological testing duties in order to undertake SARS-CoV-2 tests, which has produced a substantial influence on the number of human parasitic infections detected, which may induce inaccuracy on the actual number of cases. Inaccurate diagnosis and reported cases, as well as the missing data, can lead to erroneous and misleading estimations of epidemic parameters, which can have serious health consequences if they are not taken into consideration. This will also have a significant influence on the roadmaps for NTDs, including parasitic infections. The current treatment programs for toxocariasis are geared at reducing morbidity through school-based mass drug administration or MDA using antihelmintics such as albendazole, mebendazole, and thiobendazole to school-aged children or SAC, since this group is thought to have the highest morbidity. Since reinfection is also common due to everyday activities and environmental factors, it is necessary to continue the MDA program at regular intervals in order to have a considerable decrease in parasitic infection prevalence and maximize the program's effectiveness. The deworming of dogs and cats, as well as vector control, care and rehabilitation of pets are also advisable to prevent the spread of infection. However, with the lowest public health systems, developing countries are indeed battling the most infectious disease burdens, including toxocariasis due to inadequate health funding, lack of personal protective equipment, insufficient supplies of medications, and lack of intensive care professionals. Since the majority of healthcare systems also rely on foreign assistance for disease control and prevention initiatives, attempts to manage COVID-19 will have an influence on efforts to control other endemic health concerns. In fact, there has been a pause in the fight against parasitic diseases, which has resulted in an increased number of cases of soil-transmitted helminthiasis, including toxocariasis. The implementation of policies which delivers fundamental strategies of NTB prevention, control, and elimination programs have been compromised by the pandemic. All community-based disease prevention and health promotion services have been halted. Specifically, the monitoring and control of major NTB initiatives has been discontinued at the national level, and the preparation for mass drug administration initiatives has also been substantially hampered at the regional level. As a result, efforts to mitigate this surge should be continued as soon as possible by implementing additional global measures. A multidisciplinary One Health approach offers hope for eliminating soil-transmitted helminth infections, including toxocariasis worldwide, to balance and optimize the health of people, animals, and the environment over time. In order to promote awareness and begin initiatives to control the spread of parasites carried by dogs and cats in different communities and households, regular parasitic surveillance is required. This is attributable to the fact that practically every family keeps these animals as pets, and they might become carriers of these parasitic diseases if they come from various sources, such as shelters that have been domesticated or puppies and kittens acquired from breeders. Not only is health education important for raising public awareness about altering behavior and implementing risk reduction, but it can also limit the spread of these parasitic diseases. Moreover, there must be a strict implementation of MDA to control and prevent and move towards the elimination of parasitic neglected tropical diseases. For our conclusions, Toxocariasis remains to be a public health problem around the world, producing multi-system disease, particularly in school-aged children. The prevalence of parasite infection in dogs and cats is generally high, posing a threat of zoonotic transmission from these animals to people. Contact and cohabitation of humans with infected dogs and cats is a risk factor for infection, which is cause for concern in terms of public health given the rising prevalence of dogs and cats in urban and rural areas. Due to the magnitude of COVID-19, it has a significant impact on the diagnosis, prevention, and elimination program for neglected tropical diseases such as toxocariasis. The resumption of programs to prevent, control, and treat these parasitic diseases might assist to lower the incidence and morbidity. For the recommendations, the deworming of family pets should be scheduled on a regular and early basis. Puppies, kittens, and pregnant animals should be given special attention and preventive antihelmintics since they are the most susceptible to spread of the disease. Pet owners should also collect and dispose their pet feces in a safe and sanitary manner before the eggs become infective. Behavioral, climatic, demographic, ecological, socioeconomic factors, and development of prophylactic or therapeutic vaccines should be ongoing research directions. The effective completion of these research areas can contribute to a better understanding of toxocariasis and motivate the development of innovative strategies to prevent Toxocara infection, minimize its socioeconomic impact, and progress towards the elimination of these parasitic diseases. Here are the literature cited in my presentation. Thank you very much and have a great day ahead.